All right. Well, great. Heather, thank you so much for joining us here. So, your title, I would love to unpack your title a little bit more. So, it is Global Lead of ConsenSys Health. That's correct, right?
That's
And
correct.
all right. And so now let's unpack this a little bit. So, ConsenSys Health, what is this umbrella of ConsenSys? And I know we were talking a little bit before. It's different than the ConsenSys events that happen that a lot of blockchain people go to up in New York, correct?
Correct. The largest blockchain conference in the Americas is ConsenSys, spelled like the normal English language word consensus.
Mm-hmm.
My employer is ConsenSys with a Y at the end,
Okay.
and we're not a conference producer. We're actually the world's largest pure play blockchain company.
Got it. Wow. Okay. And so, as part of ConsenSys, what are the four main areas that you really attack when it comes to the blockchain area?
Sure. So our founder is Mr. Joe Lubin. Joe Lubin was one of the co-founders of Ethereum along with Vitalik Buterin.
Okay.
After Ethereum launched, Joe decided that he wanted to build an organization that was going to create solutions for enterprises that would complement and support and expand the Ethereum technical environment and ecosystem. So he built this company called ConsenSys with a Y instead of with a US.
Gotcha.
And over the last 4 years, ConsenSys has grown to, let's see, almost 1,000 employees
Okay.
spread all around the world. We have built and deployed several of the largest scale Ethereum-based products that people are familiar with, like MetaMask and Uport and Infura. In addition, we are commercializing a number of enterprise products in last year in FY18 and in our FY19 to come. Several of those are being positioned by me into healthcare and life sciences. Core product development is our deepest expertise. We have over 60% of our staff are applied mathematicians, cryptographers, computer scientists, and engineers.
Wow.
Building the core infrastructure that will allow Ethereum to scale and work for the needs of enterprises and governments around the world. In addition to product development, we also deliver professional services and financial services in two categories. We have a licensed broker-dealer subsidiary for token issuances that have fully regulated, and we also are a venture capitalist organization.
Wow. Okay. So you do a lot. It's what I'm hearing.
It's a very busy hive at ConsenSys. Absolutely.
Gotcha. Okay. And then there's another part of what you do, which is the HIMSS, correct?
Yes, that's correct. So my actual real work, my full actual job is
Sure.
to lead healthcare and life sciences for ConsenSys.
Okay.
But I wear a number of hats in industry as a volunteer to seek to lead this whole industry through all kinds of barriers that it faces. And the Health Information Systems Society, or HIMSS, is the largest global society for health information or health IT in the world. And the annual HIMSS conference is the largest healthcare conference that exists. There are 60,000 people that show up every year to the HIMSS conference, and it's next week in Orlando.
Yeah, February 11th, right?
That's right, where ConsenSys Health will have a very significant presence.
Wow, that's amazing.
And HIMSS has a blockchain task force. And I co-chair the blockchain task force for HIMSS.
Okay.
And the task force, as a team effort, has created a wide range of very pragmatic, grounded, rigorous, scientifically based content and strategy about how the heavily regulated industries of healthcare and life sciences can adopt this technology.
Now, you were saying something about the barriers there, and I'm hearing two very big parts, right? There's blockchain, which is a subcategory of technology, and then you have healthcare, which in its own realm is rather huge. Can you say a little bit more about some of the barriers that you're attacking or trying to solve for, some of the things that are actually coming up in the myriad of the groups that you're a part of?
Sure. So one role that I play in industry is I am the chair of the board of directors and a co-founder at an organization that is a subsidiary entity under IEEE,
Okay.
which is the Institute of Electronics and Electrical Engineering.
Okay.
And that organization is called Blockchain in Healthcare Global, and it was formed solely to mitigate barriers to adoption of blockchain and converging innovations in healthcare and life sciences.
Okay.
And HIMSS also works on certain challenges. Also at IEEE, I wear a different hat where under their Standards Association, I chair the standards development activity for blockchain in healthcare and life sciences. That's P2418.6, where we're looking to mainly to develop semantic and ontological data structures that can be used globally and internationally to improve data liquidity and interoperability using blockchain technology. So the barriers to adoption are many in this industry, and it takes a lot of different efforts from different perspectives to be able to solve such complex challenges. And another way of solving that is through the Enterprise Ethereum Alliance that you may have heard of, the EEA.
Yes.
At the Enterprise Ethereum Alliance, I chair the Healthcare Special Interest Group, where we look in a very specialized way at specifically Ethereum solutions for healthcare enterprises. And they're also a standards development organization, so we seek to harmonize with the efforts of IEEE and other standards development organizations.
Wow. Okay, so that's a lot. And I can see that you, in the various hats that you wear, I guess one of the things that would kind of help some of our viewers to better understand the current technology that is out there right now. One of the things that we get commonly is, okay, this blockchain thing is coming out. What is it trying to replace? How are things currently working? We saw that a lot when it came to even questions around, cryptocurrency. A lot of people still thought that currency was still on the gold standard, and it has been for decades, right? So there's still this lack of common understanding and education of how current systems handle our medical records today, how we currently get the job done, and why is blockchain something that we should look at? How would you say that how systems are currently handling some of the things that you guys are facing, and then why are you looking at blockchain as a reasonable or actually more than reasonable solution to replace that system or to complement it?
Yeah, so first thinking about it, assuming if the listeners are not in healthcare and life sciences and you're coming from all kinds of industries, everyone can relate to the kind of experience that they have as a patient when they seek care in developed health economies, like in the US and the EU and so on. It's very different in developing health economies and emerging markets. But for a moment, let's just think about heavily regulated developed economies.
Okay.
When you seek care as a patient, often you're asked to fill out the same forms with a piece of paper and pen over and over and over again till your hand aches.
Yes.
Very frequently, your pharmacist doesn't have the information, or the information about all the medications that you're on may be incorrect or inaccurate. Maybe one provider has your allergy information and another one doesn't. Perhaps you need to transition care and you find that you have weeks of phone calls and faxes and finally have to get irate before you can get your medical records. And then when you get them, what exactly are you supposed to do with them?
Yeah.
It's not trivial how you actually get them into the hands of your provider in a way that they can use.
Yeah.
In fact, on the healthcare provider side, it is extremely common for them to receive faxes that are hundreds of pages long.
Wow.
We're talking about digital images that are pictures of wood pulp that are hundreds of pages long. And that's our reality. In 2016, which is the date that the most recent date that this data is available, there were 16 billion faxes sent in healthcare in the United States alone.
16 billion faxes. Wow.
Yes,
Okay.
and that's data but from a study that HIMSS conducted and released through the Office of the National Coordinator of Health IT, which you can find at healthit.gov.
Got it.
But just using facts as a metaphor for everything that's wrong with health systems. If you can just imagine, why in the world would you need to send a fax? And every fax that you send is data that usually has to have a human being read it and type something.
Yeah.
The information is constantly wrong. Human error is very high. Thousands and thousands of people die every year simply due to totally preventable medical errors that largely are failings of health information technology or the absence of automation or very poor data management or data integrity.
Yeah.
So even those people that aren't in the weeds on the inside of healthcare, everybody knows what that experience is because it's the one industry where we're all subject to that industry.
Correct.
All of our lives are on the line. All of our loved ones and our family members. We've all lost someone. We've all had births and deaths. We've all gone through these things, and we can see and experience firsthand the absence of efficiencies, the challenges with the patient experience, the way that the system rewards volume instead of actual clinical value, which is everyone's goal. So these challenges in healthcare are things that everyone in our industry has been working so hard for so long to solve. There was a massive effort to support the digitization of healthcare through the adoption of electronic health records. And the government had an incredible program that provided incentives and rewards for provider organizations to digitize their operations and standards that they called meaningful use. Well, that was successful in a lot of ways. And we've had a lot of benefits of the digitization of healthcare, but unfortunately, it only kind of got about halfway done. And the original priorities of meaningful use did not prioritize interoperability of health data. It was more every discrete system, every health system had to achieve these requirements, but cross-health systems, models that allowed different organizations to collaborate on the care of one patient, that was not prioritized, though it is today. Now, our Department of Health and Human Services is rolling out a new thing called the Trusted Exchange Framework. And with the passage of the 21st Century Cures Act, we now have a whole host of external forcing functions that will support finally having liquid data in healthcare. So we're changing and it's happening, but there are a range of things that our existing technologies are not well suited to accomplish.
Gotcha.
And so I'll stop there and then I'll answer the second part of your question, but I just want to see if you wanted to react to any of that.
No, I mean, it's very telling and very relatable to a lot of the audiences that we have, even to myself, when it comes to, I've had a number of stories I could tell you where they amputated the wrong leg because somebody wrote something down wrong, just an L to an R, and even though the data was conflicting with something, and then they waited. So, this is a very real issue for anyone that has, blood cells in a body, right? So it's very, I want to say, encouraging to know that there is so much attention and so many lives involved in trying to resolve some of the existing archaic systems that have caused many of the issues that most people are trying to face, to go there to that system to resolve. So now on the second part, you said you had more to say about that when it came to why blockchain when it comes to these elements.
Yeah, so I think I would just like to emphasize that even though the patient experience can be so frustrating, it can make an end consumer feel like no one's paying attention to these problems.
Sure.
And I can tell you that there are armies of brilliant people that have all around the world that have been working night and day for 30 years on these problems.
30 years.
30 years. And have not been able to get it done. And it's
Wow.
not negligence, it's not ignorance.
Okay.
It's because the problems are really that hard. They're
Wow.
really that complicated. And it's difficult when you're outside to comprehend why should you possibly have to in 2019 fill out this form on paper with a pen one more time.
Yeah.
But there's just layers and layers of challenge underneath it. What I would say is the simplest reason why blockchain in this particular industry, and I know everyone on the line is already deeply interested in blockchain.
Sure.
If you imagine healthcare and life sciences as being characterized by hundreds, even thousands of disparate data silos that generally don't talk to one another, or if they talk poorly.
So you're talking
Uh,
about like the chiropractor's office down the street, that's the mom and pop, versus the hospital that is communicating.
Even the hospital system, the health system, is the subject of a bunch of acquisitions and consolidations. And even inside that one company, there's a whole bunch of systems that only talk to one another
Gotcha.
poorly sometimes. Then you've got the pharmacist. You've got not just one payer, but multiple payers. You've got the self-insured employer that's actually funding it. You've got the wellness program over here. Then you've got secondary insurances that kick in. And oh, by the way, the Centers for Medicaid and Medicare Services
Yeah.
too.
Yeah.
And on and on. And that it just, the closer you get, the complexity is genuinely exponential. So if for a moment you imagine transactions of all kinds processing across thousands of disparate data sets, a lot of which your data, Quentin, your data as a patient is not in one place. It's all over the place.
Yeah.
It's in dozens and dozens of places, different segments of your life.
Mm-hmm.
And some of it is when you need to coordinate care across organizational boundaries.
Mm-hmm.
It is extremely difficult in the current state to create a truly longitudinal record. And what I mean by a longitudinal record is that it is time sequenced exactly.
Got
So
it.
every transaction in all those thousands of systems has a date and time stamp.
Yeah.
And
Sure.
people think, well, how could you not know which one happened first and so on? But the data structures are all different of the underlying fields as well as the metadata.
Mm-hmm.
So at a macro level, that chaos, that white noise in that data, we have never had an intrinsically longitudinal data structure or the possibility to create cryptographically verified consensus among potentially opposing stakeholders
Got
who
that.
may not be friendly to one another or may have competing interests.
Yeah. No, I got
So,
that.
so we have in blockchain and directed acyclic graphs the first ever intrinsically longitudinal data structures that have security features way above and beyond just the cryptography through numerous evolving consensus protocols that can be used to establish ultimately absolute certitude about the correctness and the sequence of these transactions. And then we have one additional thing that kicks it up several notches, which for the first time we have these things called smart contracts that you've probably talked about a lot on your show.
Yes. Yeah. Yeah. We're very familiar with those.
I like to say that they're neither smart nor contracts. So it really messes with the world.
Sure.
I think of them as cryptographically verified distributed stored procedures.
Cryptographically distributed stored procedures. I like it. Okay.
And essentially what that allows us to do is to create process orchestration and automation outside of the four walls of any one organization.
Got
But
that.
we can create that, a layer of abstraction above any one institution or organization, and we can orchestrate business and clinical and scientific processes on mutualized federated infrastructure that is outside of any one organization.
Now,
And that can enable patient self-sovereignty downstream as well.
now, when you're talking about this, I'm hearing a lot of different intertwined areas in this ledger that has these multiple processes that are being stored, the first thing that comes up all the time is security, right? And you mentioned something about that. You highlighted that there's several layers of security. Quickly, what can we expect when it comes to the security of this kind of interwoven yet ledgerable process?
So it's interesting. The federal government and the financial services sector, the banking industry, evolved always under the constant threat of the bad guys.
Sure.
So they have been subject to constant cybersecurity attack since the first ones and zeros flowed.
Yeah, absolutely.
And so those industries are very strong from a cybersecurity perspective, and it's part of their DNA. But healthcare, not so.
Sure.
Healthcare as an industry is not accustomed to being subject to nation state level cyber criminal activity. But in the last few years, healthcare has become the most attacked industry in the world.
Wow.
Why? Because the bad guys figured out that they were sitting ducks.
Yeah.
That they didn't have their defenses up in the way that financial services does and government does.
Sure.
So, and even financial services and government still fall victim to hacking and criminal cyber threat levels.
Got that. Yeah.
So healthcare data is also among our most sensitive data. For example, if someone is HIV positive or pregnant and not ready to tell anyone yet or whatever, those things are massively sensitive beyond just identity theft.
Correct.
And now that so many medical devices are becoming IoMT or Internet of Medical Things connected, now if you hacked that data, you can actually risk someone's life.
Yeah.
So cybersecurity in healthcare is a rapidly accelerating, mounting crisis. And for the last several years, our whole industry has been forced to spring into action in a way to begin to become very, very serious and committed cybersecurity professionals, which again was not part of our DNA. In healthcare, all we ever thought about was compliance.
Sure.
Compliance. Just follow the law, check the boxes, don't be fined, don't have a HIPAA violation. But they did not think about real cybersecurity threat management and incident response.
And now you're saying that your groups are addressing that gaping hole at this point, along with the development of blockchain usage, correct?
Well, the industry has responded in terms of defending itself, but the foundational infrastructure of blockchain helps us reconsider what we even mean when we say a secure system.
Got that.
One of the most important characteristics that you can do to defend yourself is to take away the economic incentive that a bad guy has to hack a system. So if you have a big central honeypot of data and a hacker can violate that, they can get a big return on their investment of time and energy.
Sure.
In distributed systems and with cryptographic sharding, you have if a compromise does occur with one of those systems,
Sure.
you can greatly diminish the return that the bad guy would have on that action.
Got that.
So in addition to the technical dimensions of better securing our health data, especially in transmission in motion, we also can change the fundamental economics and make it less attractive to the bad guys.
I like it. Yeah, and that's embedded in the infrastructure of blockchain. So, I'm really glad to hear that. I know we're running short on time, so I just have one more question for you. So when it comes to what there is currently out now, actually it's two questions. Number one, when do you think that the public, or is there a certain region of public that can have access to trying out some of these new technologies that you're talking about that may make their lives easier when it comes to interacting with their healthcare providers? Or is there like a date or some sort of year coming out that we can actually start seeing some healthcare providers providing this new level system that'll make it easier on our patients?
Yeah, well, I would say that you're probably familiar with how dApps work, or distributed apps right?
Yes.
And generally you have to have a wallet and you have to have some cryptocurrency.
Sure.
And for some people, that's really a barrier
Yeah.
for a consumer-facing health app.
Correct.
It's maybe a level of complexity that is higher than the average healthcare consumer is willing to endure. And that's one of the reasons why ConsenSys built a new product called Shipple that makes that no longer necessary.
Got
So
that.
that if you were, let's say you were developing a consumer facing healthcare application,
Sure.
instead of that application requiring them to download MetaMask, manage their private keys, have a wallet, even understand what all that means, instead, you could actually pay the gas fees on Ethereum directly as the sponsor and owner of the app and obfuscate that entirely from the end consumer.
Wow.
So that's one of our products that we're launching in the first quarter of this year, which is a real game changer for consumer-facing apps in dApps,
Wow.
Web3 dApps in general, and for healthcare particularly, because that's just way too much all over the place
Yeah.
chaos for
Yeah.
an end consumer to master. So I predict you're going to see more and better consumer-facing healthcare applications. And down the line, FDA indicated digital therapeutics that are Web3 dApps as well. And in terms of an end consumer's ability to engage with this technology, clinical trials and being routed into clinical trials and participating in clinical trials, perhaps as a research subject, are some of the earliest ways that this is going to be adopted in a model that an end consumer would have visibility to.
Gotcha.
Lots of deployment is going on in healthcare now, but it's deployment in areas that don't involve PHI or protected health information, like supply chain, contracting, provider credentialing, things like that.
Yeah.
Because there's too much regulatory uncertainty with PHI right now. But we're getting through those problems quickly.
Wow. Well, I'm truly excited to see what happens March of this year, towards the end of Q1, especially when it comes to the dApps. I know exactly what that looks like. Heather, I want to say thank you so very much for your time. Are we going to be able to see you at the upcoming event on February 11th in Orlando?
Oh yes, I will be there at the pre-conference blockchain symposium, and then have several other speaking engagements at HIMSS through the rest of the week.
Wow.
And you can learn more about ConsenSys at ConsenSys Health at health.consensys.net, which is a site that is launching at HIMSS.
Okay.
Which I'm super excited about that. And you can learn more about blockchain and healthcare global by visiting blockchainandhealthcare.global.
We'll be sure to include both of those links onto this video. Absolutely. Heather, thank you so much for your time. This has been invaluable towards the public that we have. And for all of those who are looking, be sure to join us next time. Check out the event, the HIMSS event, February 11th to the 15th in Orlando. And we'll be posting that information as well at the end of this video. Thank you so much for joining. Take care.
Thanks, Quentin. Great talking with you.
Awesome. Perfect.